Hi, I'm Dr. Michael Gordon, Chief Medical Officer for the HonorHealth Research Institute, and welcome to another episode of Innovation Insights. I'm excited today because I'm joined by Dr. Amy Mirabella, who is our Director of Clinical Research Operations. Amy is a nurse who played multiple integral roles in our research institute, initially as a research nurse, but ultimately evolved to get her Ph.D. in general psych with a focus on cognition and instruction. And it's exciting to be here today because we're on the cusp of a second year of Health Literacy Month in October of this year, and much of this, all of this, comes from the brain trust of Amy's program. So Amy, welcome and thanks for being here.
Thank you. I'm excited to be here today.
So we're talking a little bit about health literacy, and as I mentioned, October is Health Literacy Month.
That's right.
What got you involved in health literacy as a focus?
Great question. It's really important when talking about this work for people to understand the why. So the committee is always talking about, this is my why. My why is because I had a patient who ended up in the emergency room because they didn't understand how to take their medication, which caused extra symptoms, which led them there. And then when I started looking at what could I have done better as a nurse, I could have improved how I provided that education. And so a group of us got together, a group of nurses, and said, how can we do a better job in communicating with patients? And that led to our study on health literacy. And the feedback we received from those patients and the outcome of that study really impacted that work where we knew we had to do more. 2 years ago, the Health Literacy Committee was developed out of that, and it's grown by leaps and bounds throughout the HonorHealth hospital system now. And we've just been able to do work in the community. Last year, we were able to have the governor sign a proclamation declaring October as Health Literacy Month for the state of Arizona. Now, October is Health Literacy Month for the nation, but to have the governor actually sign a proclamation acknowledging that for the state of Arizona really acknowledges and reiterates the importance of the work that we're doing.
And so it started off in many ways as a grassroots effort.
Correct.
It was based upon your personal experience, probably the culmination of other nurses and healthcare providers who shared similar experiences, leading to a study. Where do we see this going, and what role does HonorHealth Research Institute play in making that happen?
So right now we're getting ready to do a study actually in the inpatient side to look at, can we impact not only nurse satisfaction and confidence with using health literacy strategies, but can we decrease readmission rates on this specific unit that has high readmission rates? Can we impact Press-Ganey scores with questions around nurse communication with the patient? And then in the community, we're working with groups. One of the groups that we're working with takes care of young adults who are aging out of the foster care system. We're developing curriculum to be able to teach those young adults how to advocate for their health and wellness and what that looks like, you know, having a conversation with their physician when many of them have never done that before. And from that, we're looking for some grant funding to be able to write that curriculum and then create a toolbox of sorts that we can then deliver to other agencies throughout the state of Arizona who are doing some of the same type of work.
It's really just amazing and phenomenal, because what really has happened is that small nidus or focus that initiated this has burgeoned into an institution-wide, and as the institution grows and expands and touches more patients, the hope and expectation is that health literacy is going to be the leading edge or the bleeding edge of what transforms the way we do healthcare.
Right.
So that brings us to the most important question, which is for our viewers who don't really understand, what exactly is health literacy?
It's a great place to start, and it's a great question. So many times we hear people think or say that means reading level or the grade level that someone finished. And while that is definitely part of it, health literacy is really the ability of people to understand information that we give them. process that and then actually do something with it. And so that's personal health literacy. And now there's organizational health literacy, which really is what we're looking at HonorHealth Research Institute, is how as an organization are we making it possible for patients to understand information, access the services that we provide, and then do something to make informed healthcare decisions.
It really is a completely new way of providing healthcare and interacting with patients. Also, often patients walk out the door of an office and look at each other and say, what did he say? What did she mean?
Right.
And that, I think, is probably the most significant element that health literacy reflects.
Correct. And it's really about approaching patients and meeting them where they are, and providing them information and empowering them to really partner with their healthcare team, and really thinking about it like a sports team. And the player or the patient is a really integral part of that.
And so a big part of this is not necessarily just simplifying information, but really translating information into a highly understandable commodity. Because I presume when patients walk out the door, it's not just that they understand, but can they actually communicate that,
Right.
as an example, to their children who at dinner are going to say, so what did the doctor say?
Correct. And that's a big part of it. And so we have different strategies that we're using to ensure that patients are able to do that. So if we start them on a new medication, when they go home and their spouse asks, why are you on this medicine? The patient should be able to explain that to them.
That's unbelievable, and I think it's a far cry from, as a recollection, how I look back on my training as a physician and my role as an oncologist,
Right.
talking with patients. And as treatments have become much more complicated, I think, what we're beginning to sense and see is that words matter in healthcare.
Absolutely, they do. And it's important for us as healthcare team members to understand that it's our responsibility to make sure that patients can understand. It's not their responsibility. But I've been a nurse for over 30 years, and when I graduated from nursing school and you met with patients and you provided education, it was really important that you used all those big terms. It was important to show that you had graduated from school and you knew what all of that meant, and so you were showing off, and meanwhile really providing a disservice to your patients.
It's that deer in the headlights look,
Right.
when you finish talking to somebody and they just look like, huh?
Right.
What?
Right.
As opposed to that light in their eyes when it connects and they
Right.
get it and they understand what the challenges are going to be stepwise through the course of their therapy.
And that's been part of this health literacy work, is actually sitting with patients at eye level versus standing in a room with your hand on the doorknob ready to leave and asking them about the questions that they have. Really sitting with them and taking that time and watching those light bulbs go off, that part has been so valuable to us because we see that the work that we're doing matters.
Yeah, it almost seems like the seedling for this. I remember years ago in the hospital, there was a process of ask, tell, ask that we were asked to fulfill.
Right.
Ask a patient how they're feeling, how are they doing,
Right.
provide them with information, and then close the circle by asking them, do you have any questions?
Right, and that's a great point. And now we've changed that question. Instead of asking something they can answer with a yes or no, to what questions do you have for me?
Interesting. It really does. When you look at the longitudinal effort, it really reflects the fact that in many ways, HonorHealth Research Institute have been critically engaged in
Yes.
that line of communication with patients.
Absolutely.
I was going through some cards recently and found a card from a former patient of mine. And at the time when electronic medical records were first being used, she found an article referencing somebody who wrote into the newspaper about their personal experience and how the
Okay.
physician came into the office, sat down at their computer, and talked over their shoulder to the patient, never looking the patient
Right.
in the eye. And this patient of mine was accustomed to the fact that I would roll in on my little, traveling cart with my
Right.
laptop on it, but always be seated directly across from
right.
patients. And, frequently when I'm sitting with folks and having to convey news, good or bad, I rotate my computer out of the way,
Right.
creating a direct space so that that's not obstructing it. And I guess in some ways, I've been practicing some of
You
these
have
health
been.
literacy issues.
Absolutely.
Maybe that's why I'm so educable in this regard.
That's right.
What kind of feedback do you get from patients who are participating knowingly or unknowingly in this process?
And so the study that we did looking at health literacy and health literacy principles and providing education was eye-opening. We had patients who had had cancer for 2+ years make comments to us, how come no one has ever explained this to me like this before? I finally get it. And then we found that they were able to make goals that improved their health because they understood that information. And so that part we knew we were doing the right thing, but now it's taking, educating many more people so that it doesn't end with us and that this continues with patients.
Really phenomenal in that regard. Do you find that patients and their family members begin communicating together in a health literate way?
We do, because now the caregivers or the family members are also understanding the information. They feel like the patient's been empowered. We tell them, stop us, ask questions, and just allowing that and giving them permission. We'll hear things, it's okay for me to ask the doctor a question. Well, absolutely, it's okay for you to tell them to stop and, hey, I need you to clarify something. And so we see patients, family members, caregivers feel empowered, and then they take that into their own visits. And so we see the work continue.
And I have to imagine that having been through this kind of process myself, that when you go home and you talk to your children and everybody understands and is on the same level playing field,
Right.
the stress level that patients and family members are under must drop significantly.
Absolutely. And even if they don't understand or they have questions, we've created an environment where they feel safe making a phone call or sending an email to the physician or to someone on the care team and say, hey, I have questions and I need some more time.
And relative to patient emotional states or their ability to kind of get past anxiety, fear, do we feel that health literacy in this regard is enabling patients or empowering them to step beyond the stress and anxiety they feel because of a cancer diagnosis?
We do, and we also acknowledge the fact that with these visits and with these diagnoses that there is stress and anxiety negatively impact health literacy. So we'll see people, nurses, physicians who come in and you would expect to have a high health literacy because of their education and because of their experiences, but because of the stress and anxiety related to maybe a new diagnosis or a prognosis, that health literacy rate goes down. And so they are at risk for not understanding information. So by using what we call a universal approach to health literacy, we meet people where they are, we assume everyone's at risk for limited health literacy, and then build upon that in the use of plain language.
And I'd have to believe, because when you get a diagnosis, the first thing you do is run to Dr. Google.
Right.
And Dr. Google is not health literate.
Correct.
That patients come in with greater degrees of anxiety.
Right.
And not to be critical of the way we manage information, you and I know that one of the other dilemmas are, as soon as results come back, whether it's laboratory or it's CAT scans,
Right.
It's pinging on patients' phones because of
Right.
their MyChart account. And, I try and tell patients all the time, your CAT scan report is not written in a way that's literate for you as a patient.
Right.
It's written as a communication from doctor to doctor.
Right.
And that's another thing that goes up against us, because there are patients who walk in and are freaked out
Right.
because their CAT scan says they have atelectasis, a benign finding that has nothing to do with
Right.
cancer. And
But they've Googled that all over the place.
Yes, and
Yeah.
they just say they see it as being an abnormality on their report.
Right.
And of course it elevates that anxiety and that concern.
Right, and so we try to address those things with health literacy, but as many times as you tell a patient to, wait until your appointment and have those conversations, they still come in with that stress and anxiety. That's another good reason why we use these health literacy principles, because we know that their health literacy rates are going to be lower when they come in.
Yeah, and I have to believe that, as treatments have become more complex, even in the days when we would give standard chemotherapy
Right.
and we wanted to communicate the side effects or the risks that you need to be aware of, now we're looking at targeted drugs and we're talking to patients about results of their molecular testing.
Right.
It really behooves us to be consciously thinking about being health literate for the sake of patients becoming partners
Right.
in this venture.
Right, and some of the education that we've been doing is talking to healthcare teams and explaining to them that patients love visuals. And so as things become more complex, if we can draw a picture of what that mechanism of action looks like, how this drug is going to work, patients love that. And that's another way for them to understand versus handing them a written document that may be written at too high of a level for them to get anything out of.
How does literacy level of education or language barriers, DEI is such a huge element in our communities these days.
Absolutely.
How do we conquer that in a health literate way?
So it's working with the healthcare team members to have them understand that their words do matter and their words help build trust and build relationships with patients. And that's really important, and it's important to the patients. We've done a couple community surveys, and patients in the community have talked about they want to be able to trust the people that they're seeing for their care. They want to have those types of relationships. And so the words that we use, the manner in which we speak, all of that either builds trust or it doesn't. So we've got to get everybody on the same page there. There's also an opportunity to ask patients about the language that they would like to have their information provided in. Many times we'll assume that the patient speaks English and that's how I'm going to provide the education or materials, when really they would prefer to have it in another language.
So I think, in that regard, when we talk to patients about side effects of medications that we're
Correct.
going to give or other phenomenon, is there an opportunity for us to kind of create or build a virtual library of information
Yes.
that may conduct it in the appropriate language and in a way that's consistently health literate?
Correct. And so we've looked at some of those things, and that's part of our 2025 goals for the Health Literacy Committee, is to have a podcast or a video of sort where a patient could receive information in the clinic, maybe in writing and having a conversation with the nurse or the physician, and then go home and watch a video about it just to reinforce the education that was provided.
And it certainly provides patients and their families with a depth of information that they can use as a reference point.
Correct.
I think, handing them pages to take home and read may feel like it's fulfilling the goal of providing them with information, but information that they can actually internalize and can be part of their greater value.
Right.
That's the biggest challenge, it sounds
Right.
like and I would imagine that for patients who are somewhat disenfranchised because of socioeconomic issues, language issues, it's always a challenge to have them come back,
Correct.
to follow up. I don't want to use the word compliance because it suggests that they're non-compliant. I think that they're more lost
Correct.
relative to being a partner.
Correct. And that's why it's so important for us as healthcare team members to understand that when we give a patient a packet of information and tell them to go home and read it, people with low health literacy most of the time will not tell you I can't read this. I don't understand it. They will nod their head and they will take that packet of paper and go home and do nothing with it because they don't have the ability. And it's up to us to figure that piece out.
Can you share with me what's one action item that listeners should consider for their next medical visit?
Number one is to write down your questions before you come into the office. Bring paper and pencil or use your phone, whatever you want to use, but have those questions, because as stress and anxiety increase in an office visit, you're probably going to forget those questions that you had, and then you're going to leave and go, oh, I wish I had a few more minutes to go back in and ask those questions.
I find, there is still a certain degree of anxiety for patients asking if they can record a visit.
Correct.
Every once in a while I'll be sitting there and I'll see a spouse or a family member kind of turn a phone over and hit a button and place it down, and I'll tell them I welcome you to record the visit, and I'll say, why don't you put it here on my laptop space so that we can capture everything together, because I try very hard to choose my words carefully, and yet sometimes people just need to hear it again and again.
Right, absolutely. And so that's great. Not every physician wants to be recorded during a visit. And then that's another thing. We tell patients you can ask if that's acceptable, and then they have the ability then to share that. That's really only good if the physician or the provider is using language in a manner that patients can understand.
So we really need to overcome any concern about distrust that physicians may have on the process. You mentioned about writing down questions. I think that's probably one of the biggest issues that patients don't do coming in.
Correct.
And when you ask them, what questions do you have for me, I often get, I don't remember. And I think, part of the problem is our visits are very emotionally charged, and people just forget. They get very, very anxious, and therefore they don't really convey back. So sharing with people that it's okay to write things down. And
Correct.
I often tell people, you're going to walk out, you're going to have 10 questions. When you get to the car or you get home, write them down.
Right.
Call back in or bring them in next time, and we'll go over those first.
Right. Or they can share with a family member or a caregiver and then ask that person to accompany them to the visit. We recommend that a lot of times as well.
Yeah. Where do you see health literacy going over the next number of years?
So we've seen a lot about it. Now we're hearing a lot about it and its association and alignment with health equity. I think we're going to see more organizations really realize the impact of health literacy and how that can impact things such as Press-Ganey scores and reimbursement and those types of things. The other piece where we're really seeing some movement is in artificial intelligence. And what is that going to do to either enhance health literacy and really get patients to, for us to use plain language, or is that just going to be another barrier?
Can you talk a little bit about, is this an Arizona element? Are there other national programs? Are there international programs that you're engaged with?
There are national and international programs where people are coming together to work on health literacy and do more research. There's some big gaps in the research, and so more needs to be done in that space, and really getting creative for how we're working with healthcare team members, because everybody's busy. And so how do we create strategies that they can implement in their already busy schedules? Some of the things that we've done at the Research Institute, we're working at a national level with some of the organizations. We're working at a state level with different organizations throughout the state who are doing this type of work in different small communities. And then our goal for the Health Literacy Committee in 2025 is to have an Arizona State Coalition where these resources within the state of Arizona are brought under one umbrella, where everyone can share their best practices and the things that they're already developing and using.
And give me a little bit of insight, if you could. How do you gauge whether or not you're hitting your goals and being effective in achieving your endpoints?
That's involving the patients. And so that has been some of our most meaningful work, is speaking to community members as well as patient advisory boards to say, this is what we're thinking about doing, or here's our latest and greatest and what we want to do, and getting their feedback on that and finding out from them what are their priorities, what matters to them, so that it's not a group of healthcare team members who are deciding this is the route we're going to go, that we actually have patients with a seat at the table to give their input.
And is this work limited to the United States, or is this gone beyond our natural borders?
Absolutely, it's an international issue, and it's all over. People in every country are facing these same dilemmas and how to work through and really make sure that patients can understand the information that they're getting and then can take that and do something with it.
And I would imagine that as we get towards an older population, people that have certain infirmities, maybe can't hear well,
right.
Are visually impaired, that probably compounds health literacy in a significant way.
Absolutely, and so we need to find those things out up front, and that's sitting down and having conversations with patients, whoever that may be, the nurse, the physician, the social worker, nurse navigation, whoever that person is, but really asking them, what needs do you have? How can we best accommodate those needs? Talking to them about, tell me about an experience when you received health communication that worked for you. Tell me about an experience that was bad. And then sharing that with the team so we can either capitalize on those things and say, hey, this worked before, let's try this with the patient, or this is what we want to avoid because they've had a bad experience with this in the past.
And of course, healthcare in general is not exclusively an outpatient circumstance. Correct. I would imagine that with the stress of hospitalizations where patients may be better but not well,
correct,
that those discharge orders and plans of care becomes critical that those be communicated in a health literate manner.
Correct, and that's some of the work we're doing with the new to practice nurses at HonorHealth. So in the residency program, which is part of our magnet status, that our new to practice nurses are required to be in this program, they receive a 2-hour training on health literacy and health literacy principles. And we really focus on discharge and discharge teaching because we know so many things can go wrong in that space. And what does that look like when you have a very limited period of time to go over a 30-page discharge packet? We ask the nurses to pick 3 to 4 key items because we know that that's what patients can take in. 3 to 4 key items, and then what does the patient need to know about that, and what do they need to do? And then there's some follow-up pieces, making sure that they know who to call if they have questions after they get discharged.
Yeah, I was intrigued by the fact that in a recent meeting I was at, they were discussing the rates of readmission based on the day of discharge. And for patients who are discharged at the end of the working week, like on Friday, their rates of readmission were significantly higher than patients who were discharged, say, on Sunday. And I'm presuming that it's not all in the hands of the people who are doing the discharge teaching, but it's just who do I call and how do I approach these issues becomes crucial.
Right, and we also know that patients who have low health literacy have higher readmission rates.
In terms of how we practice health literacy, can you show me?
Sure.
And I think it would be helpful for the viewers, because I think for those patients that are out there who have never been with a provider who speaks in a health literate manner.
Right.
And as somebody originally from the East Coast, New York City, there are times that I can go and speak really quickly, which becomes a major element of health literacy.
Correct. So if we empower patients, because I do the same thing, not that I'm from the East Coast, but I speak quickly, when I'm going to provide education to a patient, I always give them permission to stop me and ask me to slow down.
Interesting.
And that's about part of our health literacy work and that self-awareness piece. So what is my communication style? What are the things, what does my body language suggest? And so we try to teach nurses and physicians to be in tune to that. But patients, once you give them permission, they will stop you. I've had many say, you need to slow down.
So can we do an example?
Absolutely.
All right, how do we do this?
Okay, so you can be the patient if that's okay with you.
Absolutely. I have experience doing that.
Perfect, and I will be the nurse. So let's say you're getting discharged today and you're going home on pain medicine. You've just had surgery. So we'll focus on that part, okay?
Okay.
Right, so I'm gonna come into your room and hopefully there's a chair available because I wanna be sitting. So I'm gonna sit down next to you. Say, Michael, is now a good time for me to go through some discharge teaching?
That would be great. Thank you. I'm anxious to get out of here.
I know your ride's coming soon. So there's a couple things that I'd like to go over. There's a lot of information in the packet that I'm going to give you to take home, but there's a few things that I've highlighted in the packet that are really important that I'd like to spend a little bit of time going over. Is that okay?
That would be great. I'm a little bit hard of hearing.
Okay.
So just go slow so I can kind of pull this all in.
Okay, and if I'm speaking too quickly, please let me know, or if I need to speak up, please let me know that as well.
Thank you.
So the first thing I would like to talk about is the phone number. Here I've highlighted in your discharge paperwork the phone number. If you have questions after you leave today, please call this phone number. Okay?
Okay.
And then the next is your new pain medicine. It's called Percocet. We've been giving you this in the hospital, okay? And you're supposed to take this 3 times a day. So that means when you get up in the morning and have breakfast, again at lunch, and again at dinner, you're going to take 1 pill for the next 5 days.
Okay. So 1 pill with my meals for the next 5 days.
Correct. And your meals being breakfast, lunch, and dinner.
Right.
Okay. And then here's information on your diet. And we've talked about that in the past, so I'm not going to go into all of that right now. But tell me, when you get home tonight and your wife might ask you, why do you need to take this medicine, or when are you supposed to take it? What will you tell her?
Well, I'm going to tell her that because of my surgery, I'm still having pain, and I was instructed to take this medicine 3 times a day with breakfast, lunch, and dinner for the next 5 days.
Okay.
Can I ask you a question?
Sure.
What if I don't have lunch? What if I skip a meal? Should I skip my pill?
That's a great question. No, you should still take your pill, but maybe have some crackers with it so you're not taking it on an empty stomach.
Okay. Thank you.
Okay.
I just wasn't sure if it was with my meals and I didn't have a meal or I didn't feel like a meal, should I not take the medicine?
That's a great question. And then tell me when you get home, if you have questions, who are you going to call?
I'm going to call that yellow phone number, and I don't know who's going to be on the other end, but whoever they are, that's the person I'm supposed to call.
Wonderful. And it will be a nurse on the other end of that call.
Great.
Who will then be able to provide you with some directions. When you get home today, what are you going to do with this discharge packet? Where do you think you might put it?
I think probably it would be best to maybe put it next to the telephone in the kitchen,
Okay.
because that's where we make a lot of phone calls, and my wife is usually there making my meals, so she'll know, oh wait, I have to get the pill for him, either there or maybe on my nightstand, so that
Okay.
if I think of something during the night that I forgot to call about earlier, I can look it up and see it and write down on it to make sure I call in the morning.
Okay, perfect. Okay, so what questions do you have at this point before we send you home?
I don't know. I think I have to know when I'm going back to see the doctor. You're having me take the pain pills for the next 5 days. Does that mean my pain will be gone after the 5 days?
Great question. No, it doesn't mean that, but it'll just mean that you're done taking that medicine. And you'll see later in the packet on page 23, and we'll go to that this is when you need to call your doctor. You'll need to call your doctor tomorrow to make an appointment for the next 7 to 10 days.
His office is always very good about asking me questions and
Okay.
providing me with information. So I'll make sure that I share with him the stuff that I've learned today. Is he going to know all of this stuff already?
He is. We'll send him copies of all of this. You can also take your discharge paperwork because it has all of your medicines and your aftercare, all of that information in it, so you can take this to your appointment as well.
That's great. I was really nervous coming in for this surgery, and I have to admit and say that people would ask me why I was coming in and what was going on, and I was a little bit confused about things, not in a way that made me question whether I should have it or not, but I feel much better going home with this plan and understanding it.
Wonderful. And so tell me, when are you going to call the doctor to make an appointment?
I'm going to call him tomorrow morning to make sure that I follow up and figure out when I have to come back and see him.
Okay.
And if I have a problem or I have any new symptoms, I'm going to call the yellow number and speak to the nurse.
Okay, wonderful. What questions do you have?
I don't know that I have any questions.
Okay.
You've really been so helpful. Thank you for helping me understand this. I feel like when my wife pulls up in the car and she says to me, "So what?" I'm going to be able to tell her exactly what we need to do. But in case I can't get it all together, I'm going to tell her to call the yellow number to get the information.
Wonderful. Well, it's been great taking care of you.
It's been great being taken care of. Thank you very much. So that's an interesting experience. And thank you for that. It's, as somebody who has been through that process, it's interesting for me to look at it on that exit. I think that there are times when those kinds of discharge discussions sometimes veer away from the patient and focus on the caregiver.
Correct. And you were a stellar patient. They don't always go quite that smoothly. One thing that we've really worked with the nurses is trying to get them to understand that nursing is a 24-hour-a-day job. And so it's not just up to the nurse who, in that 10 or 15 minutes, the nurse who's discharging the patient, all of that responsibility doesn't lie on them. Really, discharge teaching should start from the time we admit a patient. And so what does that look like as we build upon that education throughout a patient's hospital stay?
Well, this has just been phenomenal. I really have learned a lot, and I'm so impressed with the program that's been developed here at HonorHealth and at HonorHealth Research Institute. I had the personal experience of working with you and Amber when we met with young physicians, our residents, and I think you and I had a similar kind of perspective that were we getting through to them?
Right.
And then at the end, the hands started going up and the lights started going off, and the residents were reporting to us experiences where they felt communicating in a health literate manner would make a huge difference in the way they experienced as a physician the delivery of care.
Right. That was fun. And Amber and I were so happy that you were able to join us. And we wondered how two nurses teaching this group would be received. So we had to bring Dr. Gordon along with us. But I will tell you at the end, after class, I was out in the hallway and one of the surgical residents stopped me. And he said, "This has been the most impactful 2 hours of my career thus far. I understand the changes that I need to make, and I tell you that I'm going to make them." And to me, if it was one person, it was worth it.
Are there any places where our viewers, if they're interested in information, can go to seek out more information about health literacy, learn about it, practice it?
Absolutely. So the CDC has some great information for the community about health literacy. There's also a website. It's AHRQ, I'm going to have to look at my notes, .gov with the keyword questions. There they actually have a tool that helps you build questions, helps a patient build questions for their visit, and then they can either download that onto their phone or print it out. And there's videos to watch about how to come to your visit prepared. How do you ask a question of your physician or your nurse, and what does that look like? So there's some amazing tools. They can also contact us at HonorHealth Research Institute. Myself, if we're going to give that information to viewers, I'd be happy to help
You heard it. Amy is available if you need it.
That's right.
That's the phone number in yellow,
That's
my
right.
friends. So what would the one takeaway, if you were going to encapsulate this last 30 minutes or hour that we've spent together, what's the takeaway that you want our viewers to recognize and appreciate for their own healthcare and their own life experiences?
Say that the one takeaway is the permission to ask questions, to ask someone who's providing you health information to stop and slow down or re-explain in a different way. And you need to feel empowered. We want you to feel empowered to be able to do that.
We're super excited at HRI for all the work that you and your team are doing to not just help our patients, but really advance the next generation of caregivers, nurses, physicians, all of the team to understand the importance of this.
Well, thank you.